It is the appointed time and we have a quorum. The meeting is convened. Now we proceed with the first meeting of the panel on health services for the 2022 legislative session. We will elect a chairman. According to the Secretariat, as at the close of the nomination period for chairmanship of the panel, only one valid nomination was received. That is Mr. Tommy Cheung, nominated by Ms. Dari Lee, seconded by Mr. Ben Chen. Mr. Tommy Cheung has not been elected as the chairman or deputy chairman of other panels, and he is not the chairman or deputy chairman of any government advisory bodies. According to the regulations under the Rules of Procedures and the House Rules, I announce that Mr. Tommy Cheung elected the chairman of the panel on health services for this legislative session. I invite Mr. Cheung to preside over the meeting. Thank you, Mr. Chan Kin Po. Now we proceed with the election for deputy chairmanship of the panel on health services for the 2022 legislative session. A notice has been issued that as at the close of nomination period for deputy chairmanship of the panel, only one valid nomination was received. That is Ms. Rebecca Chan, nominated by Mr. Ben Chen and seconded by Mr. Chan Kin Po. Ms. Rebecca Chan has not been elected as the chairman or deputy chairman of other panels, and she's not the chairman or deputy chairman of any government advisory bodies. As a result, according to the Rules of Procedures and the House Rules, I announce Ms. Rebecca Chan elected the deputy chairman of the panel on health services for this session. Congratulations. Now, about the meeting schedule for this legislative session, that is the regular meeting between February and July. We used to set the schedule for the whole year, but this time, only 6 months. A list of meeting dates is tabled. First, the 11th of February, that's the a policy briefing session. On the 16th of February, we will have the motion of thanks for the policy address on the 16th, 17th, and 18th. And then the second meeting shall be on the 11th of March. They are all Fridays. The third meeting was scheduled at the 8th of February. However, it may conflict with the special finance committee meeting because the budget will have been tabled and then we will spend a whole week discussing the budget. We propose having the third meeting at 10:45 a.m. on the 1st of April. That's April Fool's Day. So maybe we can say anything we want because it is the April's Fool Day. And then the 13th of May, 10th of June, and the 8th of July. All Fridays, 10:45 a.m. For the meeting on the 11th of February, that's the policy briefing and our own meeting. If this is agreeable to you, the Secretariat will issue a notice informing members of the agreed meeting dates for this session. Agreed. Item 3, items for discussion for the next meeting. As the Council meeting on the 16th of February 2022, we shall debate on the policy address. The Secretariat has reserved 10:45 a.m. to 12:15 p.m. That's a 1.5 hour on the 11th of February. That's a Friday. for us to receive the briefing on the 2021 policy address by the Secretary for Food and Health. Do we all agree with this arrangement of the policy address, policy briefing? No objections. And also the government proposed that we discuss our measures on prevention and control of the COVID-19 pandemic at the meeting on the 11th of February. To allow ample time for discussion, we proposed extending the meeting on the 11th of February from 10:30 a.m. to 1 p.m. That is 2.5 hours. Is that agreed? So my initial thought is I would like to have this special meeting as soon as possible to discuss about the outbreak. However, the officials are very busy. They may be too engaged before the Chinese New Year. And it is quite difficult to find another slot after the Chinese New Year. So how about we stick to this schedule first? Mr. Ben Chen, Chair, I agree that government officials are very busy with the pandemic, and this outbreak came so suddenly. There are many suggestions, and we would like to make to the officials. It may be difficult for government officials to attend in person. Maybe we can arrange for a virtual meeting and see if we can have a meeting sooner. Well, I am trying to arrange that too. But it is not likely that we can have virtual meeting before Chinese New Year. We did try to arrange it, but it seems that won't be ready before the Chinese New Year. So depending on the pandemic situation, we propose having this meeting on the 11th of February until 1 p.m. I can give you 15 more minutes if you don't mind a late lunch. If it is agreeable to the government officials to attend a virtual meeting, or if with the outbreak situation is even more serious, then maybe we can arrange a meeting during the Chinese New Year. Of course, I don't want to ask you to come back to work during the Chinese New Year holidays. I will follow it up. As per the previous arrangement, the chairman and the deputy chairman of this panel would meet with the Food and Health Bureau and discuss the work plan of this panel in the session. If you have any suggestions about the items for discussion, please notify the Secretariat in written form. Has a meeting been scheduled with the Secretary for Food and Health? Not yet. So if you have any suggestions to make, please give us 1 or 2 days notice so that we are ready to bring it up with the Secretary. Mr. Michael Tian, sorry, something wrong with my glasses. There are 2 items that I would like you to bring up with the Secretary. First, reviewing the efficacy of district health centers and also the progress of the program. Second, our quarantine centers. if there is a major outbreak, the capacity is not enough. It seems that the service is quite poor, and the government is working on it. Actually, independent houses are the best choice in terms of ventilation. The Secretary for Development has mentioned this option. So can this panel have a meeting with the Secretary for Development and reserve some independent houses in case there is another outbreak? No one knows what will come after Omicron. Mr. Tian, this is about the work plan or items for discussion of this panel. If you have any other suggestions, please send it to me in written form, and I will convey the message for you. Mr. Lee Sai-wing, thank you. 3 possible items for discussion. For elderly people, we are very concerned about the flexibility of elderly healthcare vouchers. In the 18 districts, we have a shortage of dental facilities for the elderly people. 3, the Kowloon East and New Territories East clusters are conducting some expansion projects for hospitals. I think it is an appropriate time for the HA to brief us on the progress. And also, we would like to know what new programs will be available after the expansion projects. The needs for medical healthcare services, especially maternity ward in Cheung Kwan O Hospital, is very dire. Mr. Leung Wing Kit, thank you. Now, the emergency hospital in Wong Tai Sin. For residents in Wong Tai Sin, if accidents and emergency services needed, they will they will have to go to another district, requiring 22 minutes or 40 minutes. And also the QE hospital, the expansion project, we want to know more about it, and also about ophthalmology service and dental service for residents. The queues are long, so we want to review the efficiency. Ms. Priscilla Leung, I propose discussing about the professional conduct or ethics of medical staff. We know they are working very hard. However, we hear rumors about private doctors putting up notices discriminatory to mainlanders. Now, about remote or telemedicine, what's the progress? I agree we should discuss on the application of elderly healthcare vouchers to the GBA. Mr. Wong Kwok Keen, Chair, I would like to discuss the developments of Chinese medicine in Hong Kong. There are many people who rely on Chinese medicine services. So shouldn't we discuss the developments of the industry? Dr. Dennis Lam. Sorry, the speaker is not coming through the mic. Would you please press the button? Yes, you are coming through. With the aging population, if we can develop our primary healthcare better so that people can age at home and prevent disease, this will be very good. And about the e-health system, it is not very user-friendly. So please think about how to optimize it. I agree we should optimize the dental care services. We should extend the students' dental care program to secondary students, and we should consider the development of Chinese Western medicine collaboration.
Mr. Lemon Kwong. Chairman, thank you. Also, hospital redevelopment. After the redevelopment in 2015 for the Caritas Hospital, in 2019, in the 10-year program, they're gonna have the third phase of redevelopment. 3 years on, we have heard nothing about it. It is said that 500 more beds will be added. It is important for the Kowloon West. We'd like to find out about the third phase redevelopment of the Caritas Medical Center. Mr. Duncan Chiu. I am a member of the HA, and I sit on a committee on the smart hospital. The members talked about the technology over the years. My observation is that technology seems to be happening in a piecemeal manner. I think we ought to have a look at the smart digital policy for hospitals. When we launch technology in a piecemeal manner, there are many problems like EHR. It is not used by the private clinics. Also, telemedicine, we've done some pilot, and I don't think we have gone far enough. Without any legislation, the technology development will not be able to get anywhere. In 2018, the NHS has published the policy regarding digital hospital licensing of the internet, implementation, supervision, and so on. All these would help with the development of technology in the healthcare sector. So I hope that we can have some discussion as to how we can harness technology in the hospital setting and healthcare setting. Thank you. Mrs. Regina Ip. Chairman, now, this is not of an urgent nature, but nonetheless, this should be studied. We heard a lot of rumors. Now, in fact, many private practitioners are also admitting to this. They're hollowing out the hospital authority. Many are joining the healthcare groups. They're paying enormously. That they undergo training at the HA, but they would be leaving the HA once they're done with the training. How are you going to deal with this? Or we can bring in more non-locally trained doctors who are Hong Kong residents. Well, I heard that in the children's hospital, the doctors want to have some laser treatment training. That's because they want to undergo training and they go into private practice. Well, for the training, many doctors, once they have acquired the expertise, would leave the system. We've seen a lot of that happening. Ms. Connie Lam. Chairman, thank you. I hope that we can talk about the nighttime service for the GOPC, and also the balance of resources for the rural and urban settings. In Sai Kung, the population is increasing, and in the long run, I think the government should have the rural-urban healthcare system. There are some NGOs that are running the DHCs in Clearwater Bay, Sai Kung. I hope that there will be some DHCs that will be created to broaden the coverage of the service. Under the HAA clusters, there are no services overnight and also over public holidays, and I hope that some discussion can take place there. Okay, thank you very much. Item 4, any other business? And just to let members know that starting from this term, the sign language interpretation will be extended to the regular and special meetings of the HS panel. For joint panel meetings with other panels, the service will be provided where necessary. Unless there are any further points, the meeting is now adjourned. Thank you all very much.